Most people assume that staying healthy after 70 means saying yes to every test a doctor offers. But what if some of those routine screenings are doing more harm than good? It may sound risky to question them, but aging bodies have different needs. And not all medical advice ages well. The truth is, many tests still pushed on older adults were designed decades ago for younger, stronger systems. For seniors, these checkups can lead to anxiety, invasive treatments, and complications that never needed to happen. More and more doctors who specialize in aging are starting to challenge the status quo. They're asking whether some of these tests are actually protecting people or just feeding a system of habit. In today's video, we'll uncover 5 health screenings that adults over 70 might want to skip or rethink and offer you safer, smarter alternatives backed by current science. If your goal is to stay sharp, independent, and in control of your health, then what we're about to share could be life-changing. Keep watching. What you discover today might just save you from unnecessary harm tomorrow. And before we begin, if you haven't subscribed yet, go ahead and tap that button and turn on notifications so you never miss another video made with your health in mind. If you find this helpful, comment with the number 1. If not, type 0 and let me know how we can improve. 1. Routine PSA testing. For many older men, I'm just hearing the words prostate cancer is enough to send the mind racing. The PSA test, short for prostate-specific antigen, has long been promoted as a quick, easy way to catch trouble early and protect your health. But if you're over 70 and feeling fine, this test might do more harm than good. Here's why. PSA levels naturally go up with age, even if you don't have cancer. The test is very sensitive but not very specific, meaning it can detect tiny, slow-moving changes that would likely never affect your health or lifespan. But once a high number shows up on that report, panic sets in. I've seen it countless times. Fear, restless nights, pressure to act fast. Take the story of Mr. Donnelly, one of my patients, a 74-year-old Navy veteran who spent his retirement tending his garden and enjoying time with his wife in Wisconsin. A different doctor persuaded him to run a PSA test during a routine visit. The result, a mildly elevated score that led to a referral, a painful biopsy, and even talks of radiation, despite no serious cancer being found. The side effects, months of urinary issues, fatigue, and stress that drained the joy from his daily life. All for a test that didn't find anything truly dangerous. Sadly, his case isn't rare. Research shows that most prostate cancers found in men over 70 grow so slowly they'll never cause symptoms, much less shorten life. That's why leading health organizations like the U.S. Preventive Services Task Force advise against routine PSA tests for older men, yet the test still happens far too often, not because it's needed, but because of fear, the fear of missing something, the fear of regret. But fear isn't the same as wisdom. If you have no symptoms, no trouble urinating, no pelvic pain, no unexplained weight loss, it's okay to skip the test. Ask your doctor a simple question: will this help me live better or longer? If the answer is no, it's a sign to pause. Because the truth is that peace of mind you're chasing might be stolen away by needless procedures and stress. Your care should be tailored to you, not just numbers on a page. And if you think this is the only screening you should question at this age, wait until you hear about the next one. It's a test that looks deep into your body, but could quietly steal your freedom. If you're still here and finding this information useful, type 1 in the comments so I know you're with me. Let's keep going with the next insight. 2. Abdominal aortic aneurysm rechecks. When repeating tests may do more harm than good. There's a quiet kind of fear that settles in when people imagine something silently expanding inside them, waiting to burst. For many older adults, this fear takes the form of an abdominal aortic aneurysm, a swelling of the main artery that runs through the belly. It's no wonder that the first time this is screened, usually around the age of 65, people welcome it. It feels like catching a danger before it strikes. But what often goes unspoken is what happens after that first scan, especially when it shows nothing serious. Most people don't realize that repeating the test years later, especially when nothing has changed, can start a chain of events that causes more harm than good. Medically speaking, most small aneurysms grow very slowly, if at all, and the risk of rupture remains extremely low if the initial scan didn't show significant changes. But if a patient returns for a follow-up scan out of caution or habit, even the smallest change in measurement can set off alarms. Suddenly, a person who felt perfectly healthy is being labeled as a potential emergency. They're advised to return every 6 months, to watch the bulge carefully, and sometimes even told to consider surgery just in case. That's where the real trouble can begin. Let me share the story of a patient I remember well, Mrs. Mendes, who was 82 at the time. She was a widow living in a peaceful corner of Northern California, spending her days helping out at the local library and sharing weekly lunches with friends. She had undergone her first abdominal scan at 66, which came back completely normal. But many years later, during a routine visit to another clinic, a new doctor encouraged her to repeat the scan. This time, they found a tiny enlargement just 3-4 centimeters wide, far below the size that would ever require medical intervention. But hearing the word aneurysm unsettled her deeply. She couldn't sleep. She gave up traveling. Her daily life changed, not because of the aneurysm, but because of what it represented in her mind. The doctor recommended imaging every 6 months, and even went so far as to suggest surgery to be proactive. Eventually, she agreed. The operation led to complications, a serious infection, weeks in the hospital, and a long period of recovery that cost her the independence she had cherished. Ironically, the aneurysm itself might never have caused her any harm, but the chain of decisions that followed the rescreening did. This is what healthcare professionals call overdiagnosis. It means identifying something that technically exists but is unlikely to become a threat, and treating it anyway, because we feel we must act. In elderly patients, especially those over 75, the risks of surgical intervention, blood clots, infection, reduced mental sharpness, and loss of physical function are real and significant. In cases like this, the danger isn't always the health condition, it's the path we take out of fear. When we allow one small finding to spiral into repeated tests, ongoing stress, and risky procedures, we need to pause and ask the most important question. Is this path helping, or is it quietly hurting? If your first scan showed no danger and you feel well today, then the safest step might be to leave things alone. Because not every test needs to be repeated, and not every small finding needs to be treated. But what about the next test? The one that sounds even more advanced. Imagine a machine that can scan your entire body in one go. It seems futuristic, impressive, thorough, but could it also come with risks we don't see right away? That's what we're about to explore. Let's continue. 3. Repeating bone density tests after 70. The misleading numbers that can weaken you more than they help. As we get older, the word fragile begins to follow us more closely. It appears in conversations with doctors, in pamphlets about senior health, and in our own thoughts when we notice we're moving a little slower or feeling a little less steady. So when the topic of bones comes up, most older adults naturally feel the urge to act. They're told that thinning bones mean one bad fall could lead to catastrophe. That message alone is enough to make regular DEXA scans, the bone density tests seem essential. But here's the deeper truth. If you're over 70 and you've already had a bone scan or even started treatment, repeating the test every few years may not be helping at all. In fact, it could quietly be setting you up for more harm than good. Bone density declines with age. That's biology, not failure. But in the medical world, we often reduce this complex reality into a number, a single score, that tells you whether you've crossed into osteopenia or osteoporosis. The problem is that these labels often trigger automatic responses, like prescriptions for medications that may not even be necessary. I've seen it too many times. A patient is told their T-score dipped below a line, and suddenly they're placed on bisphosphonates or injected drugs. These medications, while useful in select cases, can also cause significant issues, damage to the jawbone, persistent stomach upset, joint pain, and in some paradoxical cases, even unusual thigh fractures that would not have happened otherwise. Let me tell you about Barbara. She was one of my most graceful patients, 80 years old, a retired piano teacher from Ohio who stayed active with daily walks and fresh meals. She cooked herself. At age 72, she had a scan that showed mild bone thinning, something very common and not alarming. Her physician at the time offered reassurance, but at 6.5 years, she underwent another scan. This time, her score just crossed the threshold into what's defined as osteoporosis. A new doctor, concerned by the number, recommended immediate treatment. She started weekly bone pills and later received injections. Unfortunately, in the medications introduced side effects. She had never known digestive discomfort, dizziness, and weakness that left her more vulnerable than before. One day, while bringing groceries inside, she stumbled and fractured her wrist. The very outcome these medications were meant to prevent, but it wasn't brittle bones that caused the fall. It was the fatigue and side effects from the drugs themselves. This story isn't rare. It highlights a deeper issue with how we view health after 70. We become fixated on numbers from machines and lose sight of real-world strength, mobility, and independence. Bone scans may offer data, but they don't capture how well someone moves, how strong their legs are, or how balanced they feel walking across a room. According to current recommendations, bone density should only be rechecked if the result would change your treatment. And yet, many older adults are placed on long-term medications that are never reevaluated. They stay on them for years out of habit or fear, not because of new evidence. What keeps bones resilient isn't more testing, it's consistency in movement, proper nutrition, and avoiding overmedication that erodes vitality. So before saying yes to another bone scan, pause and ask, will this actually change anything I do? Or will it just lead to more labels, more pills, and more worry? Because fear, not fractures, is what weakens so many older patients today. And if you've ever stared at a spot on your skin wondering if it's something dangerous, you'll want to hear what's coming next. Let's explore what routine skin checks really mean and what they sometimes miss. 4. Skin cancer screenings without suspicious moles. As we grow older, every mark on our skin starts to feel like a question mark. A freckle that looks darker than before, a new spot that wasn't there last month. Naturally, many seniors feel anxious. Dermatologists, with the best of intentions, often suggest full-body skin checks every year, even when there's no complaint or visible change. But here's something few will say out loud. If you don't have any concerning symptoms, these routine screenings can quietly cause more harm than good. Most common skin cancers in older adults, like basal cell or squamous cell types, grow slowly and rarely spread. They often remain harmless for years. In fact, many people pass away from other causes while still living with these kinds of lesions, completely unaffected by them. And yet, one mole, one age spot, one small rough patch is all it takes for a biopsy to be scheduled. Often out of an abundance of caution, not medical necessity. Let me share the story of Mr. Franklin, a 79-year-old former mail carrier from Kentucky. A soft-spoken man who loved card games and community gatherings. Over a 2-year period, he underwent 7 different skin biopsies. Each time, the result came back non-cancerous, but the aftermath wasn't so benign. Scars dotted his body. One on his cheek particularly affected him. It changed how he saw himself and became quiet, hesitant to go out, and eventually stopped joining his weekly bridge club. Not because he had skin cancer, but because the repeated procedures stole a piece of his confidence. This is the emotional cost we rarely talk about, especially in older adults with delicate skin and slower healing. Even a small biopsy can turn into a drawn-out wound, an infection, or a constant reminder in the mirror. Instead of chasing every freckle, the better strategy is awareness with purpose. If a spot starts bleeding for no reason, becomes itchy all the time, grows rapidly, or changes shape or color, that's a signal worth listening to. But if your skin has remained stable and you feel fine, ask yourself if the checkup is really for your benefit or just out of routine fear. Are you being seen as a whole person or just another case number under a bright exam light? And now, after looking at tests that affect your blood, your bones, and your skin, it's time to talk about one of the most commonly recommended evaluations for seniors, especially those with any history of heart concerns. But what if this test, meant to detect problems early, could actually put your heart at risk instead? Let's look closely at what happens when you push the heart too far. 5. Cardiac stress tests in seniors. There's something sacred about the heart. It's not just a physical organ. It holds emotions, memories, And meaning, so when a doctor suggests a cardiac stress test simply as a precaution, it feels hard to refuse. But for seniors in their 70s and beyond, these tests, especially treadmill ones, can carry more risk than benefit. Originally designed to assess how the heart responds to exertion, this test was built for younger adults. As we grow older, natural changes occur. Arteries become less flexible. Heart rhythms change slightly. Blood pressure becomes more variable. None of these shifts automatically point to disease, but stress tests often interpret them as warning signs. This is where the dominoes start falling. A mild irregularity leads to a cardiologist referral. That becomes a recommendation for an angiogram, which may involve contrast dye that taxes the kidneys. Sometimes it leads to the placement of a stent, or even open heart surgery. All of this without any real symptoms in the first place. Take Mr. Halverson, for example. At 82, this former truck mechanic from Iowa was still mentally sharp and physically active. He walked his dog every morning, ate pancakes with his grandkids every Sunday, and never experienced chest pain or shortness of breath. But during a routine checkup, a stress test was suggested just to be sure. That decision changed his life. The results were inconclusive. A catheter procedure followed. Doctors found some mild artery plaque, nothing unusual for his age, but inserted a stent just in case. Days later, he had a bleeding complication due to the medications prescribed. He was hospitalized for over a week. Since then, his mobility has declined, and so has his quality of life. This isn't rare. That's why top cardiology and geriatric associations now advise against routine cardiac stress testing in older adults who have no symptoms. If you're not experiencing chest discomfort, sudden fatigue, or breathlessness while active, it's worth asking, is this test really necessary? The evidence shows these tests don't lower the chance of heart attacks or improve survival in people without symptoms. So why are they still so common? Often, it's fear. Fear of a hidden danger. Fear of dying without warning. But fear should not dictate healthcare decisions. Real heart health after 70 is measured in how you live. Are you moving your body each day? Are you eating nutritious meals? Are you staying connected to people who matter? These habits do more for your heart than any treadmill test. Sometimes saying no to another test is the most courageous thing you can do. But if we shouldn't default to tests, what should healthcare look like after 70? Let's talk about that. Wise healthcare after 70, meaning over machines. At this stage of life, healthcare should stop being a race through lab results and scans. Instead, it should become a reflection of your priorities. After 70, it's not just about adding years. It's about adding value to those years. That means protecting your mental clarity, your ability to move freely, and your peace of mind. Unfortunately, many older adults find themselves caught in a system that treats aging like an illness, as if every wrinkle or slowed step must be corrected. But aging is not a flaw. It is natural. It is to be honored, not treated like a malfunction. Smart care at this age doesn't mean doing nothing. It means choosing carefully. It's about asking the right questions. Instead of asking, what test do I need? Ask, will this help me feel stronger, think more clearly, or enjoy life more? If the answer is no, maybe it's time to decline. I've cared for too many vibrant, curious seniors who came to me after months, sometimes years of being shuffled from test to test. Treatment to treatment, their biggest regret, not speaking up sooner, not asking, do I really need this? Not guarding their time like the precious gift it is. Because time in your 70s and 80s is not just time. It's legacy. It's your morning walks. It's laughter with grandchildren. It's the quiet satisfaction of living on your terms. Rather than chasing test results, focus on daily movement, gentle stretching, morning walks, light housework. Eat in ways that nourish your digestion and give you energy. Get enough sleep. Laugh when you can. Hug often. Say the things that matter. Let go of what you cannot change. And above all, believe that your aging body still carries wisdom. Work with doctors who listen. Choose treatments that align with your values. Not just your diagnosis. Let medicine serve your life, not take over it. When a test is offered, take a moment. Ask yourself and your doctor, what are we really trying to find out? And what could this test cost me in worry, side effects, or lost joy? You are not just a chart. You are a person with a story still being written. You deserve care that reflects your humanity, not just your biology. So as you move forward, stop asking, what more can be done? Instead, ask, what truly matters enough to do? That's the art of aging with wisdom. That's the power of living with intention. If something in this video spoke to you, I'd love to hear what stood out. What will you do differently? Now, please leave a comment with number 1 if this helped, or 0 if not, and don't forget to subscribe. Share this with someone you care about, and come back for more conversations that put you, not just your test results, at the center of care. Thank you for watching, and here's to living your later years with clarity, strength, and purpose